The feet, the area that carries the entire weight of the world on a daily basis. Despite the thousands of steps our feet take, we hardly ever pay attention to the slight alterations they undergo. We frequently take good care of our hands and face, but we frequently overlook our feet, which might reveal very important information about our general health. I'll show you how to use your feet as your most reliable messengers in this video. Together, we'll list 12 odd foot symptoms that are frequently disregarded but may point to diabetes. And that's not all. In order to avoid serious difficulties, I'll also provide you advice on how to take care of and safeguard your feet. Prepare to explore. Have you ever felt like your feet are being pricked by pins or as if you're losing sensation in them? This isn't just something that happens after sitting too long or sleeping in an awkward position. If this sensation happens frequently or lasts for a long time, it could be a warning sign from your body. When your body doesn't manage blood sugar levels well, the nerves, especially in the feet, are often the first to suffer. This condition is called diabetic neuropathy, and it causes numbness or tingling. Think of nerves as a delicate electrical system. High blood sugar acts like water corroding the wires. If not addressed, these sensations can evolve from a light tingling to burning pain, or even complete numbness. That means you could injure your feet without realizing it, which raises the risk of infections or ulcers. Instead of ignoring these strange sensations, keep track of how often they occur. If you notice a pattern, consult a doctor and check your blood sugar right away. Have you noticed your feet or ankles suddenly swelling as if they are mysteriously retaining water? Don't be too quick to assume it's just from standing or sitting too long. Swelling can be your body's way of signaling an issue with blood sugar control. When blood sugar remains high for a long time, it affects not only the nerves but also the blood vessels. The small capillaries in your feet start to lose their effectiveness, which causes excess fluid to get trapped in the surrounding tissues. Imagine water being stuck in a reservoir with no outlet. It builds up and causes swelling. This can be accompanied by a heavy or painful feeling. Left untreated, it can put pressure on blood vessels and increase the risk of blood clots, a dangerous complication of diabetes. Your feet's dry and cracked skin may appear to be a weather-related or cosmetic problem, but occasionally it's a silent warning from your body. The body loses water more quickly when blood sugar levels are high, which dries out the skin, particularly on the feet. In addition to being uncomfortable, dry skin cracks provide entry points for bacteria and fungus, increasing the risk of infection. Additionally, diabetes might harm the nerves that regulate your perspiration glands. The skin loses its natural oils, which aid in moisture retention, if those glands malfunction. Even severe dryness and cracking result from this. Keep your feet clean and moisturize on a regular basis to protect them. If you ever notice a small scratch on your foot that doesn't heal and eventually becomes a sore, don't ignore it. This could be a signal from your body that blood sugar levels are too high. Long-term elevated blood sugar weakens the immune system and damages small blood vessels. These vessels are responsible for delivering oxygen and nutrients that your body uses to repair wounds. If they're not working properly, even a minor injury can take weeks or months to heal. In people with diabetes, these slow-healing sores are more than painful. They can lead to severe infections, tissue death, or even amputation if not treated in time. Do your feet often feel icy cold, even when it's warm outside? Cold feet aren't always caused by the weather or thin socks. Sometimes they signal a deeper problem, especially if you're diabetic. High blood sugar can damage the circulatory system, limiting blood flow to the limbs. When blood can't properly reach your feet, they don't get enough oxygen or warmth. This is also a sign that small blood vessels may be damaged. Nerve damage from diabetic neuropathy adds to the problem by disrupting the body's ability to sense and regulate temperature. So even if you're wrapped up warmly, your feet may still feel cold. If this is combined with numbness or changes in skin color, it's a red flag that should be checked by a healthcare provider. Have you noticed areas of your feet changing color, becoming darker, paler, or reddish without any obvious cause? This kind of discoloration is not just cosmetic. It could be the result of poor blood circulation, a common complication of diabetes. When small blood vessels are damaged, they don't deliver blood evenly to the tissues. Some areas may turn dark from pooled blood or pale from lack of oxygen. Red patches can also appear from inflammation or irritation. In more serious cases, these color changes may hint at deeper tissue damage, chronic inflammation, or even the beginning of necrosis. If these color changes persist or worsen, don't ignore them. Have your feet examined by a medical professional. Toenails that become thick, yellow, brown, brittle, or misshapen may seem like a minor annoyance, but they could signal a deeper issue. High blood sugar weakens the immune system, allowing fungal infections to take hold more easily, especially in places like the toenails where moisture and bacteria tend to accumulate. Fungal infections can cause nails to thicken, discolor, or even change shape. Poor blood circulation makes it harder for the body to repair and regenerate tissue, which leads to nail deformities and pain. If not treated, this can turn into something more serious, like cellulitis or infected ulcers around the nail. Have you noticed the hair on your toes or lower legs gradually disappearing? It's easy to chalk this up to aging, but it might be more serious. Hair loss in this area often results from poor circulation. Just like plants need water, hair needs blood flow to stay healthy. When high blood sugar damages small blood vessels, the hair follicles don't get the nourishment they need, so the hair thins and falls out. Nerve damage can also affect the ability to maintain hair growth. It may be a subtle sign, but it's one that points to broader vascular and neurological problems often associated with diabetes. Blisters or small fluid-filled sacs appearing on your feet for no clear reason might not seem like a big deal, especially if they don't hurt. But painless blisters can be signs of peripheral nerve damage, a common complication of diabetes. When nerves lose their ability to feel pain or pressure, you may not notice injuries as they happen. These blisters are usually filled with clear fluid and may seem harmless, but if they're not properly cared for, they can become infected. High blood sugar also weakens the skin's barrier, making it more prone to irritation from shoes or friction. If you spot a blister, keep it clean, don't pop it, and see a doctor if it doesn't improve. Do you frequently get foot infections that don't seem to be related to anything? Recurrent infections are a serious cause for concern. The immune system is weakened by high blood sugar, which makes it more difficult for your body to fight off even basic bacteria or fungus. Due to the constant pressure, friction, and moisture they experience, feet are particularly susceptible. It might take a long time for a small cut or sore to heal after becoming infected. The issue is exacerbated by poor blood flow, which slows down your body's natural healing process. If left untreated, diseases like cellulitis, skin rashes, or fungal nail infections can develop into chronic conditions. Do your feet hurt every time you walk, even if your shoes fit well and you haven't been on your feet all day? This kind of pain may be more than just fatigue. It can come from damaged nerves and blood vessels, both of which are common problems in people with diabetes. When blood vessels are narrowed or blocked, the muscles in your feet don't get enough oxygen. That can lead to pain, cramping, or a heavy feeling while walking. This condition is called peripheral artery disease. Nerve damage may also cause your brain to receive pain signals even when nothing is wrong, making each step feel painful. Left untreated, this pain can limit your mobility and lower your quality of life. Have your feet changed shape over time? Maybe they've started to arch unnaturally, swell in certain areas, or develop new bumps. These changes can signal serious nerve and blood vessel damage from diabetes. When the nerves in your feet are impaired, the muscles lose their ability to support your bones properly. This can lead to deformities, such as Charcot foot, where the bones become weak, leading to fractures and dislocation. You may not even feel the injuries because of numbness, so the damage goes unnoticed. Over time, pressure points on your feet can develop calluses, sores, and even infections. If untreated, these changes can lead to loss of mobility or even amputation. So what should you do to protect your feet? The answer lies in paying close attention to them. Your feet are like a map of your health. Start by checking them daily, especially the soles between the toes and around the nails. Watch for swelling, redness, cuts, or any changes that don't heal. Clean your feet regularly and moisturize them to prevent cracks, which are open invitations for bacteria. Choose comfortable, well-fitting shoes that don't rub or press against your feet. Most importantly, maintain good blood sugar control. A balanced diet, Regular exercise and medical checkups are the cornerstones of preventing complications. And if you spot anything unusual, seek medical help without delay. Your feet carry you through life. Treat them with care, and they'll carry you further, safely and steadily.